Today we are going to start types of observational studies. Common studies designs are highly testable in exam. They will ask you what type of studies was performed. The answers will look like this and it will be several studies types. Let's go through each type. Case series used to find clinical findings and symptoms. It describes several individual patients with the same diagnosis, treatment, or outcome. It gives description of clinical findings and symptoms. It has no comparison group, thus cannot show risk factor association with disease. A cross-sectional study is purely observational and it asks what is happening at this exact point in time. Because it takes place in the present time, it collects data from a group of people to assess the frequency of disease and the related risk factors at a particular point in time. It is a snapshot study design. In other words, it gathers data about exposures and outcomes simultaneously. While it can show risk factor associations with disease, it does not establish causality. The characteristic measure for cross-sectional studies is disease prevalence. Now, do you remember what prevalence means? Prevalence is defined as the proportion of people in a population with a disease at any given time. The equation says the number of people in a population with a disease over the number of people that were at risk for getting that disease. An example of a cross sectional study would be looking at smokers versus non smokers and their frequency of peripheral vascular disease. Here you're collecting data in the present moment to assess the frequency of peripheral vascular disease within a group of smokers versus a group of non smokers. Okay, so what is the major weakness of this type of study? So we've mentioned this before, right? While it can show correlation, it doesn't prove causation. Why is that? Let's say we're looking at a particular risk factor and its association with a particular disease. Now, one might rush to conclude that this risk factor in fact causes this disease, when in fact there could be some other risk factor that we're either unaware of or aren't measuring that causes both that risk factor and the disease. So these two things are correlated, but one does not cause the other. A case control study asks what happened. Because it is observational and retrospective, it looks into the past and compares a group of people with disease to a group of people without disease. The cases are the subjects with disease, while the controls are the subjects without disease. And in a case control study, you are analyzing previous exposure. The typical metric for case control studies is the odds ratio, which in this context is defined as the ratio of the odds of exposure in the case group to the odds of exposure in the control group. But how do we define the odds of an event? So the odds equal the probability of an event happening over the probability of that event not happening. Okay, so let's define P1 as the probability of exposure in the context of the disease, and let's define D2 as the probability of exposure in the context of no disease. Now, if we do that, putting everything together, we define the exposure odds ratio as P1 over 1 minus P1 over P2, 1 minus P2. So this together would be the odds ratio. So let's try to make this more concrete by using a specific example. Here we have an example of a case control study where we're looking at exposure to asbestos, which is a material found at construction sites and shipyards and the development of mesothelioma. Here you are looking into the past and comparing cases with the disease to controls without the disease and analyzing their previous exposure to asbestos to see if cases with cancer had higher exposure rates. So suppose the study finds that the probability of exposure to asbestos in patients with cancer is 0.75, while the probability of exposure to asbestos in disease-free patients is 0.25. Now, how do we set up our odds ratio equation for this? Well, we would do 0.75 over 1 minus 0.75 over 0.25, 1 minus 0.25. Plug in the numbers into our odds ratio equation, we get an odds ratio of 9. So a patient who has exposure to asbestos was 9 times more likely to develop mesothelioma. Next up is the cohort study. A cohort study can be prospective, in which case it asks who will develop disease, or it can be retrospective, in which case it asks who had exposure. It compares a group with a given risk factor to a group without the risk factor to assess whether or not that risk factor increases the likelihood of disease. The cohort is the group with the given risk factor, and in a prospective study, you follow the cohort into the future to see if they'd get the disease of interest. The characteristic measure for cohort studies is relative risk. This is defined as the ratio of the probability of the event occurring in the exposed group versus a non-exposed group. And what that looks like is basically just P1 over P2. In this case, P1 is the probability of having the disease if exposed, while P2 is the probability of having the disease if you are unexposed.
This study answers the question, how much more likely is the patient to develop mesothelioma, to use our previous example, if they work at a construction site with asbestos? A different example of a cohort study is the famous Framingham Heart Study. One thing this cohort study examines is uncontrolled hypercholesterolemia and future risk of myocardial infarction. Here, you are looking into the future to see if groups with uncontrolled high cholesterol have a higher likelihood in the future of developing a myocardial infarction. So suppose that P1, or the risk of developing the disease if you have high cholesterol, using our same numbers before, is 0.75, and P2, which is your risk of developing an MI if you don't have high cholesterol, is 0.25. What is the relative risk? Well, this equation is actually a lot simpler than the odds ratio equation, because all we are going to do is put 0.75 over 0.25, and that equals 3. Here's another way to compare case control studies and cohort studies. This point is the present. In case control studies, there are two groups at the present time. One group that has the disease and the other that doesn't. The study looks to the past to find out, were they exposed? So what would a cohort study timeline look like? Well, again, if this is the present day, then you have two groups. All the patients are healthy at this point, but one group has an exposure and the other group doesn't. The study looks to the future to ask who will actually develop the disease. The last two types of studies are twin concordance studies and adoption studies. Twin concordance studies compare the frequency with which both monozygotic twins and both dizygotic twins develop a disease. This measures the heritability of a disease. Specifically, the more concordance a disease shows for monozygotic twins relative to dizygotic twins, the greater the heritability of the disease. Adoption studies compare siblings raised by biological versus adoptive parents to separate heritability from the influence of environmental factors on disease. This is looking at that characteristic nature versus nurture when it comes to complex diseases. Ecological studies. Ecology is the scientific study of the relationships between living organisms and their environment, including both the living, biotic, and non-living, abiotic components. It compares frequency of disease and frequency of risk-related factors across populations. It measures population data, not necessarily applicable to individuals. It also used to monitor population health, like COPD prevalence was higher in more polluted cities. If we go through from this table, there are 3 blocks respective to time. If you focus in past, we do case control study, and also in a retrospective study, we also review the previous records of
past about exposure of risk factors. In present, we done cross-correctional study in which we compare disease prevalence. In prospective cohort studies, we check the effect of risk factor of present and compare the disease's incidence. The cohort study can be prospective or retrospective, but risk factor has to be present before the disease development.